Well, hello and welcome to all of our viewers around the world. I'm Fiona Lang Sharp, IBCLC Director of Communications and one of the MCs here at Gold Learning. Well, I'm here today with Karen Strange, which I'm so excited to introduce to you, reintroduce you. You probably already know Karen from before, but I will tell you she's going to be here with us. The exciting part is she's going to be here with us at our Gold Midwifery Conference. And not only that, but all of you listening in right now will have an opportunity to listen to her. And that is because she is one of our keynote presenters here at Gold Midwifery this year. And that means that everyone will have access to it because it's an open access presentation. So there's no excuses, right, Karen? Everyone can show up. Wherever you're working in the field of birth, you need to be at this presentation. It is important and valuable that this information is spread around the world and globally. And understanding and a base knowledge is going to be absolutely fabulous. And really, we know that Karen is the queen of all things when it comes to resuscitation. So I'll tell you the title of her presentation, Neonatal Resuscitation Today, New Guidelines, Changing Tools, and Getting Priorities Right. I couldn't think of a better topic title for you, Karen. Welcome back to Gold. It's so good to have you here today.
Thank you. Thank you, Fiona. I'm happy to be here. I'm excited to be here again, actually.
Yes,
Yeah.
yes, yes, yes.
Yeah.
No, it's going to be fantastic. And I will mention to everyone listening in, head over to the website right now to goldmidwifery.com. You can check out all the details of the entire event, but remember, Karen's is free and open access. So you might even have a friend that you know that needs to join us for that time. So you can get all the details there. Well, let's get in and reintroduce Karen to you, just get some, things that you might not know about her. But Karen, tell us where you are in the world these days. Where are you living? What does it look like for you? What does your day-to-day look like?
Oh, let's see. I live in Charlottesville, Virginia.
Nice.
Um, I have a dog and a cat. They're laying on the floor. I wish you could see
Lovely.
them. Uh, I travel a lot still, and I'm home. I do a little bit of Clover's a little hospice therapy dog, so I do that. We did a little bereavement class for kids yesterday. It was
Oh,
fun,
nice.
fun. Yeah. Yeah. I'm needless to say, if you've ever taken my class, very involved in animals, and love helping. So um
That's
yeah,
wonderful.
that's it. I hike. I like to
Keeping
hike. I love to
busy.
cook. Yes, yes.
Yeah.
And I'm always figuring out classes. So when the next
Yes.
classes and how to make it easier for people to not have to think about what a baby needs when they're in distress. So
Correct.
yeah,
That's right. So let's get into and talk a little bit about your classes because you've taught neonatal resuscitation to, we can't probably even come up with a number, thousands of birth workers over decades. And many really hear hear your voice, during real resuscitations. That's what they talk about. That's what people say about you. But
right.
tell me, what really first drew you to this work and what keeps you so deeply committed to how newborns are supported in those first few moments?
Good question. So what drew me to this? So
Hmm.
I think really in the beginning, like the fear that used to come up around possibly having a compromised baby, having a
Sure.
baby that didn't respond, didn't just naturally come around like most babies do, like the fear around that and not
Hmm.
really knowing, like really knowing, not just the flow chart, not just numbers, just like really knowing what needs to happen. And so,
Hmm.
so that's how I became a neonatal resuscitation instructor for the American Academy of Pediatrics. And then the other piece is when I started to learn a little bit more about pre and perinatal psychology and
Right.
how babies have consciousness,
Mm.
in utero and at birth. That's a major drive of mine. And again, thinking about being confronted with a compromised baby, like what does a compromised baby really need? Not only to
Right.
help them breathe, but to help them over this incredibly intense experience.
Mm.
And so I sort of blended them together, and now I'm driven to doing that. And I've taught about 18,000 people,
There
Fiona.
you go. I knew it was in the thousands.
Yeah, a lot of them are repeats, but really
Sure.
18,000, over 18,000.
Yeah. I
Yeah.
mean, this is mandatory, and this work needs to be updated all the time. But it is so interesting because you're fully immersed. You see kind of what happens, and this really leads me to my next question because when a newborn needs resuscitation, and that's where you went, with thinking about what the infant needs. Everything can feel urgent and overwhelming for everybody. We know this, right? This is where you focus on. From your experience in both maybe hospital, out of hospital settings, where do you see providers most often getting pulled away from what truly matters in those moments?
Hmm. Panic, fear around what's going on.
Mm-hmm.
And so we start grabbing at and doing instead of like really knowing what is the most likely problem and the most likely resolution to the most likely problem, right?
Right.
Like really driving that home because panic definitely comes up in all of us. It's hard to
Mm-hmm.
see a compromised baby, and some of us sort of get really lost in
Right.
that panic that comes up. So it has to be like really clear so that you're not grabbing at, do I stimulate? Do I give it oxygen? Do I suction? Oh, I don't know what to do. Do I keep suctioning? Do I keep driving?
Right.
Right. Like, what does a baby really need? And my drive is to make it really clear so that you know exactly what needs to happen, whether or not it's your baby or you're at the birth and you're confronted with a baby that doesn't transition fully. What needs to happen? So
Mm.
I think it's really critical to talk about the adrenaline that comes up, the fear that comes up when confronted with a compromised baby. I think that's like, so missing in some of our trainings.
Ooh, yes, I
Yeah.
can see. Yeah, I mean, we know that when those urgent situations arise, we're trying to manage our own feelings, emotions, but yeah, we're dealing with real, our own hormones that are raging at this point, right? With,
Yeah.
adrenaline and so forth and so on. So yeah, that's really fascinating. I hope you're going to talk more about that in your session.
Of
Um,
course, of course, of
what
course.
I think I can always learn about those things because we're always learning about ourselves, and how we evolve and especially in urgent situations. I want to talk a little bit about the new guidelines, in terms of, the updates, they've expanded the role of which to include laryngeal mask airway, I believe.
Hmm.
Can you tell me a little bit about that? What do birth professionals most need to understand about these changes, and how can they support the sort of that least traumatic resuscitation? Is there a short answer here? I know you'll probably expand
Yeah,
it,
yeah,
but tell me a little bit
yeah.
about that.
I think I would say overall, and going through this and putting it to paper for the
Hmm.
presentation, I really got that the American Academy of Pediatrics Neonatal Resuscitation Program is actually like expanding more to, I think, how midwives already think.
Right.
Like the cord clamping is a little later, a little longer. You can do cord milking, right?
Hmm.
So it's beginning to encompass, I think, more of how a lot of midwives think already.
Mm.
Um, the thing about the laryngeal mask airway or the LMA, really an important piece that I feel an important tool that every midwife should carry, especially in out of hospital birth. And it can be a first go to. You can,
Mm.
of course, start with your bag and mask. But if
Hmm.
that doesn't work, you can go right to the LMA, or you can even start with LMA. The studies prove the efficacy of the LMA
Wow.
is so greatly improved. And I'll just say, in the debriefs that I do with people, I've done thousands of hours of debriefs with people around resuscitation. The stories I have now heard of the baby taking, 10 minutes to come around, they put the LMA in, and boom, the baby comes around in the next minute. Like, it
Mm.
just creates a much better open airway, gets their oxygen saturation up. So, yeah, I feel
Amazing.
like every midwife should carry one. And I understand the hesitation around it because we're not used to doing it, but it is a really helpful tool. So I hope to break down some of the fear around that in my presentation.
Ooh, that sounds
Yeah.
really good because I think when there are changes like that and there's, additional equipment, it's changes are hard anyways, right? So I'll look forward to hearing you talk more about that during your
Yeah.
time with us. As I wrap things up today, I've been thinking about, you know, um, some of the things that you teach on that I've heard from you previously. I'm so glad, honestly, you're back, especially with the updates. But you have always struck me as a person that just, well, first of all, I know you think outside the box, and that is really true. But you're very compassionate about, again, you mentioned the infant, but also, the birth workers, the midwives predominantly who are there. So beyond sort of the algorithms, the equipment, I know that your teaching really emphasizes on presence, prioritization, and the baby's experience. What do you most hope for that the participants joining us for this presentation will really take away with them that they'll carry into real birth experiences after attending this session?
Well, I for sure will cover that. I think it's really critical to have a little practice and how to have a little practice. And
Mm-hmm.
I start all my lectures, no matter where I lecture, online, in person, or my class, with a little orienting to the here and now and
Mm-hmm.
being present in your body, especially because talking about resuscitation is deeply stimulating, deeply activating to our nervous system. And many people, if they've been in the birth world, have experienced difficult or traumatic births. And that
Right.
often comes up as soon as we start talking about it. So if you don't have a little practice to even start from a place of ground and a place to go back to periodically while we're talking about it, you're if you don't have that practice and that tool, it's very easy to sort of get lost in it and let that take you away, because same physiological response comes up even though we're practicing on dolls, right? Like
Mm,
it's still the exact, not as intense, but some of that comes up, the drive to get the baby going, and our heart starts beating. And so it's really helpful to have specifically some tools for that. So yes. So, of course, we'll talk about it. I'm going to show you some simple ways to remember. Anybody that's taken my class knows I talk about that. We do it when we're practicing the counts, when we're doing the drills, right? They're still going to remember to because I'm highly repetitive for sure. So I remind people, and it seems like it works because I hear how at birth somebody is always saying, "Hey, feel yourself on the floor," or "Let's take a breath,"
yeah.
or like it's really unifying and orienting
Mm,
for our nervous system. So
yeah.
yeah. So
Well, there is no doubt that this
mm,
presentation will ground people in what they're doing and will give them the tools that they need to feel confident. I know it will because I've heard you before, but I know that every time I come back to hearing you again, emphasize these things, reevaluate them, the emphasis is back on ourselves first. So I will definitely look forward to hearing you talk about all those things and pull ourselves, look at our internal workings so that we can then fully participate in those births. Thank you so much,
yeah.
Karen. I'm just so delighted that you're here. You've got time for us. It is a real delight and pleasure for us to be able to host
Mm,
you again. Being a keynote presentation is just such a joy. And it just means that from this point forward, our responsibility, all of us, whoever's listening in right now, make sure that you share this widely. Head over to goldmidwifery.com. You can share it with your colleagues and your friends. Make sure that they're there. It will be recorded as well, of course, for your viewing, but we will look forward to all of those that can participate with Karen and
mm,
us on the day. And of course, we'll have a live Q&A to ask all those poignant questions once again. Yeah.
yeah.
Thank you,
Yeah.
Karen. Great to
Thank
see
you.
you.
Thank
Thank you.
you.
Thank
Great to
you.
see you again.
Yes, thank you.
Bye,
We'll look forward
everybody.
to seeing
Hope
you on
to
the
see you.
day. That's right. We'll look forward to seeing you on the day. Bye bye for now,
Bye
everyone.
bye.